summarizing my policy brief, which focused on the opioid epidemic in the United States. So in 2016, it was estimated that between 115 to 130 Americans die every day from opioid-related overdose, totaling to 42,000 deaths in the year of 2016. In addition, 11.5 million Americans aged 12 and older have abused prescription opioid medication, and 2.1 million Americans suffer from opioid use disorder. The opioid epidemic has also increased the prevalence of infectious diseases, especially those spread intravenously, and have resulted in increased rates of HIV and hepatitis C ever since 2012. And it has also increased the foster care homes as a result of orphan children from these opioid-related drug overdose deaths. So this is something that America really needs to focus on and really needs to tackle. So the emergence of opioid medication was as a result of two events. In 1995, the American Pain Association decided to state that pain was the fifth vital sign, and as a result of this, in 2000, the Joint Commission came out with a standardized approach to treating pain management in hospitals, and especially in patients who are undergoing pain. So this created an overprescription of opioid medications in the United States and increased the tolerance and dependence of Americans on opioid medications. So the US government realized that this was becoming a more prevalent topic and problem. So in 2015, the federal government worked with the CDC, and in 2016, the CDC released a 12-step criteria for physicians on how they should prescribe opioid medications in acute pain. So while this was great, it really was a result of the lessons learned by healthcare providers since the prevalence and emergence of the opioid crisis. So the standard of care for opioid use disorders is medication-assisted therapy, known as or abbreviated as MAT, with behavioral therapy. So medications used are naltrexone, buprenorphine, and methadone, and therapies include cognitive behavioral therapy, individual therapy, and group therapy. So the MAT, in conjunction with these behavioral therapies, really allows patients and physicians to work together as a team to really understand the psychosocial stressors the patient is undergoing, and to take an in-depth look and approach as to all contributing factors that play a role in patients seeking opioid medications, and why they are at predisposition and increased risk factors to abuse opioid medications. So this has shown to significantly help opioid users, and however, the MAT programs are not funded by Medicaid, and as a result, a lot of opioid users do not have access or affordability to these programs that can significantly help and alter their lives. So it is very important and very crucial that America works in the future to help increase funding for these programs. Increased funding does exist for naloxone, which is an opioid antagonist and reversal, and can prevent opioid-related drug overdose deaths. However, not all opioid users will overdose, and the naloxone is used for more extreme opioid users. So we need to find ways to implement policies and funding for MAT in order to address more people and to create an increased access of treatment for opioid users, in the hopes that we can decrease the prevalence, decrease the dependence, and decrease the tolerance of Americans on opioid prescription drugs. Thank you.